Good morning, everybody. Welcome on this wonderful Monday morning. I hope wherever you're joining us from, you're keeping it cool on this hot summer day. I'm very excited to introduce and join you all in having a robust discussion this morning on beyond patient engagement, why patient success matters. We're very excited to have an incredibly talented panel of presenters today. And without further ado, let's go ahead and jump on in. We're going to be covering three key areas today. First, we're going to have a discussion from KLAS Research on insights that they found out of their research. We're going to have a presentation from Luma Health's Chief Medical Officer on why patient success matters. And we'll close out with a wonderful guest, a real operator in healthcare, to have a roundtable discussion on why patient success matters and what our panelists are doing to make patients successful throughout their journeys in healthcare. So let's start with introductions, and then we'll hand it right off to our wonderful presenters. We'll be starting today with Dan Sheck, who is the Senior Insights Director at KLAS Research. Then Tashfeen Ekram, Luma Health's co-founder and Chief Medical Officer, will talk a little bit more about what patient success means. And then we'll be joined in a roundtable discussion by Renee McKibbins, who is the Director of Operations at Maury Regional Medical Group in Tennessee. So without further ado, I'm going to hand the baton over to Dan. My name is Aditya Bansod. I'll be your MC for the rest of the day, and I'll see you on the other side at the discussion. But Dan, over to you.
Thank you, Aditya. Really excited to be here with you and the group today to share some of our recent research that we've done focused on the voice of the patient. A little bit about KLAS Research for those listening that may not know about us. Our goal as a company is to provide transparency to the industry on how well healthcare IT vendors and services firms perform for their customers. And so this research that we've done is a little bit of a departure from KLAS's core focus historically, but we're excited to amplify the voice of the patient because we believe that transparency, whether it's from the patient, the provider, the payer, helps the industry be better. And ultimately, we want to help the world deliver better patient care through that transparency. So a little bit of history context on why KLAS did this research. A couple of years ago, just before the pandemic, we did some patient-facing research, and this was just a small sample, a few hundred patients that we reached out to and gathered data on social media, LinkedIn, Facebook, just to get a quick pulse on what do patients care about. And at the time, some of the patient priorities, as you'll see here, were very interesting. The things patients cared most about were the things that helped them take advantage and be empowered in their care. They wanted to self-schedule appointments, to register online, to fill their prescriptions. And what we noticed as we looked at what was highest priority for patients is that didn't always align with what vendors were developing and what provider organizations were investing in. So we asked ourselves a question: why is there this disconnect? How can we as an organization help the industry align better where applicable? Or in cases where maybe misalignment is okay, how do we come to a point where patients can feel really empowered and engaged in their care while still meeting provider and vendor needs? So we follow this up with a survey of provider organizations asking what they were investing in, where are they spending their money, what capabilities were they using at a broad level. And some of those things that patients cared the most about, the ability to self-schedule, to register, were at the time some of the lowest priorities for providers. So we left ourselves with this question: what can we do? How can we shine a bigger light on this? Now, obviously, with the number of patients in the world, a sample of 200 was not significant. So we chose to go and look a little bit deeper at this problem. And why did we do that? I love this quote. I was sitting in a room of CMIOs last month, and one of the CMIOs raised their hand and shared this thought that consumers were becoming a lot more influential at their organizations. And it just resonated with the other CMIOs in the room. So if consumers are becoming more powerful, how can we really put their preferences at the front and center? So we did a survey, transparency. We did this in collaboration with Frisia. This was a survey that was asked to patients as they performed their online check-in process. And we surveyed just shy of 13,000 patients for this study. So really deep insights that we looked at across a lot of different demographics of age and race and engagement, specialty, those types of things. You'll notice the top things that patients desire today in a more recent and robust sample are still many of the same things that they cared about a few years ago. They still wanted to be empowered in their care through self-check-in, through the registration, through paying their bills online. There's still, however, some disconnects. And we feel if an organization can put the patient needs first, then many of the provider needs and desired outcomes will follow. So here are a couple of examples of the biggest disconnects from what patients are experiencing today versus what they desire to do. So about a third of patients reported that they could schedule, could refill their prescriptions, could communicate with their doctor's office prior to a visit. But you'll notice 2/3 of patients wanted to be able to schedule their appointments online. And what they're looking for is true self-scheduling, the experience that they get in other industries. Perhaps a good comparison is booking a flight or a hotel. You can do that in a matter of seconds through an app on your phone. And you have a different experience oftentimes in the healthcare industry. If you can schedule through an app or through a portal, sometimes it's even a request for an appointment and the organization has to call you back. So a lot of opportunity for the industry to meet patient needs here. A couple of the things that I want to just touch on really quickly. I know we have a lot to cover in a half an hour. We asked patients, how frequently do you use your patient portal? We get a lot of reports in the industry of how deep adoption really is, but we wanted to understand how often patients really feel they're using their portal. And you almost have this story of thirds. You have a third of patients that are, well, what I would consider pretty deep users of the portal, using it once a month or more frequently. Then on the flip side, you have this group that's either never been in their patient portal or doesn't even think their provider offers a patient portal. And then I really see this other third as the opportunity in the industry. How can we engage them deeper? And it doesn't have to be through a portal, but how can we engage them through technology to really tie them into our organizations, to give them the empowerment that they need, and to allow them to do that digitally like they do in so many other industries. We asked patients what factors do they value most when they're choosing where they receive care. A few of these things, appointment availability, convenient location of a doctor's office, those aren't really things that you can change. You're not going to move your physical office location to accommodate your patients. However, you've got this group of what we call digital access tools that I think are real opportunities for healthcare organizations to better meet patient needs. How can you deliver a great check-in process? That third one down, the ability to know cost of care. We know price transparency is regulated now, at least for a certain number of conditions. As patients are paying more out of pocket, as they're on high deductible plans, they really want to know, what is their visit going to cost them? What will this procedure cost me? Do I need to look at another organization that perhaps offers a more competitive rate? Now, one last thing that I want to hit on is telehealth. This has obviously exploded during the time of the pandemic. A lot of opportunity in the industry with telehealth technologies. So we asked patients, regardless of what's happening for provider organizations with reimbursements, what are patients really caring about? So out of that group of nearly 13,000 patients, we asked, how many virtual visits did you do in the past year? And you almost had half of organizations shared that they had done one or more visits, half that hadn't done any telehealth, and then just a few percent that weren't quite sure if they'd done a virtual visit or not. So let's assume we've got half that have, half that haven't. So what are those two groups planning to do on an ongoing basis? The first group, those that have done a virtual visit, if we go to the next slide, you'll see they plan to continue their virtual visit adoption. You've got 60% of patients that are either planning to do significantly or slightly more virtual visits in the coming year, or they plan to maintain about the levels that they were doing before. So you see those that have experience plan to keep doing it. And then here's a view of those that haven't done telehealth. What are their plans on an ongoing basis? And 40% of those said they're likely to try telehealth going forward. So those that have done it have an appetite for it. Those that haven't are willing to try it. So to me, this says patients want telehealth. They want that flexibility to not have to disrupt their whole day to go and visit their doctor. How can they meet that convenient need? And more importantly, how can organizations offer this in visit types and patient needs where it's applicable, and help them navigate to those that are offered via telehealth? How can they get there, do it conveniently? And those that may not be offered via telehealth, how can organizations be upfront about that? I'll conclude here. We won't go deep into the study demographics, but this will be included in the slide deck. One I do want to point attention to on the bottom in the middle is the relationship with the doctor. We asked patients, do you feel you have a collaborative relationship with your doctor? Is it reactive or is it detached, meaning no relationship? And this was very interesting. In almost all cases where we asked about technology, those that had a more collaborative relationship reported higher adoption of all the technology that organizations were offering. So as a provider organization, I would consider, how can you create that type of a relationship with your patients through interactions with the physicians and the front office staff? How can they feel like they're really engaged in their care, which will lead to better outcomes, but also a better technology experience for them?
Dan, thanks so much for sharing questions, sharing your insights, and sharing the voice of the patient here in this discussion around patient success. What we're going to do is, just to keep ourselves on track, there's a couple questions queued up. We might move those to the roundtable discussion, kind of pepper those in to get some of your and KLAS's insights, kind of bubbling through the roundtable discussion as we move forward. Next up, I'm going to invite Dr. Ekram, Dr. Tashfeen Ekram, and he's going to join us and provide the physician's perspective. Dr. Ekram is a radiologist and one of the co-founders of Luma Health. And so, Tashfeen, over to you.
Good morning, everyone. Thank you, Dan, for your great insight. My name is, as I did the mention, my name is Tashfeen Ekram, the Chief Medical Officer here, and practicing radiologist. And I'd like to really put forward a new concept, which is on the next slide, is called the Great Patient Disconnect. And what I'm going to talk about is something that I've experienced both in my own practice and what I've heard from a lot of providers, is that we are spending a lot of time trying to engage and invest in tools that can drive patient engagement. But despite all that, there's a big disconnect into the experience that providers are having and the experience that patients are having. And this is really captured in the next slide by this quote by James Hereford, who's the president and CEO of Fairview, which is a large health regional medical center in Minnesota, which says, we'd like to do it all. Get patients in faster, keep a full schedule, ensure patients stick to their care plans, engage and guide them once they leave, and get them to return to follow-up care. But we struggle to simply reach our patients. And really, and that last sentence is really capturing what the problem is, that they're having a great disconnect, that you were investing a lot of money, but it's not giving us the return. So if we look at the what's happened on the next slide, as healthcare systems have invested more and more resources into digital tools, we see that there's an increased effort on their side. And we see this amongst our customers. Since 2020, which is around when the pandemic hit, we've seen a increase in usage of our chat functionality by 50%. We see also that despite that, even if you talk to providers and healthcare systems, it is a top of mind focus for them, that hey, we need to invest in digital tools. We need to be able to drive greater and greater patient engagement. And this is coming in investing in patient portals, in messaging services, and in other ways and tools, digital tools that can drive a lot of that patient engagement. If we go forward to the MGMA poll, 90% of organizations are currently offering patient portals. But really, the striking statistic here, and this again goes back to this concept we're talking about, is the great patient disconnect, is that only a third of the patients use them. And as Dan presented this data too, is that there's something much deeper going on here. There's a stronger story that we need to figure out. Why is it that we are investing in patient engagement tools, but we aren't getting the results that we need? So it's really about identifying the gap. And we'd like to break it down into kind of 3 different buckets here, which is that we need a solution that is accessible to all, that is timely and convenient. And let me just quickly walk through a patient scenario that I see on a personal basis, in my practice, and which is, imagine a woman who's up for a screening mammogram. And so she gets an appointment reminder. the day before, 2-3 days before, and a message asks her, hey, you know, I'm reminding you about your appointments coming up in a few days. If you need to cancel, please call us. And then life hits. Her child gets sick, you know, maybe she's a caretaker for her parent, whatever happens, but life gets in the way. And when the appointment comes around, she's trying to cancel, but now she's trying to take care of her child who's sick and is unable to go to school. She's now has to get on the phone to make an appointment or to reschedule her appointment. It's not convenient. Now you can see is that she actually is engaged, but she is having trouble connecting with the provider. And this is really captured in a quote that we see on the next page, next slide is, even when I use my doctor's patient portal, I end up needing to call and wait several weeks to be seen. And this is really the sentiment, is that what we find is that, and this is actually echoed in Dan's data, is that patients want to engage, patients want to be successful, patients want to help themselves. But unfortunately, there's this disconnect which is keeping us from being engaged. And then what patients are looking for is they're looking for real-time answers, but it's difficult for them to figure out what is the actionable next step. As we are all patients, when we've logged into those patient portals, it's a menu, and it's hard to know what I need to do next to make sure that I stay healthy. And that's really this concept of being great disconnect, of the great disconnect. 89% of patients would like easier access to their health data, and again, this is really grounding that idea that patients are interested, patients are engaged. I think oftentimes we like to put them as providers and healthcare systems when outcomes aren't reached, or when it's difficult to drive the things that we are trying to drive with our patient engagement, that we often have the tendency to reach out and blame our patients. But really, it's that patients are engaged and they want to be engaged. Only 29% of patients say that we actually do a good job of engaging, which is kind of unfortunate. One of the barriers that we see drive really this engagement problem is being able to meet the patient where they are. And so, for example, having our engagement happening in a channel where patients are comfortable in communicating channels. So that could be a different, it could be either a particular language preference that they have, or it could be a channel that they prefer. So now I want to introduce this new concept, which is going beyond engagement. And I think, you know, it's been grinded through us through the last 5 to 10 years as we've invested all this money into different digital tools, that it's all about patient engagement. But I'd like to put forward a new concept, which is called patient success. And really what this is grounded in is in equitable access to care, easy communication prior to, during, and after care, and staff visibility. And I'd like to draw an analogy here quickly, because I think a lot of folks here have experience in this, is that in the healthcare system, we're seeing a big shift from fee for service to pay for performance. And what that really is that unfortunately, healthcare has been incentivized to do more and not do better. But this new payment model that's coming forth is driving us not to necessarily do more, but to actually do better or be more successful. And this is really the concept behind what we're trying to put forward at Luma Health, is that it's not merely about engagement, it's about patient success. That it doesn't suffice to be able to send a message to the patient. It's really about getting that patient to the successful outcome that the patient and we as providers would like them to have. So kind of putting a comparison of what this looks like, patient engagement often, the way we will frame it sometimes, or the way healthcare as currently adopted it, is about buying things or investing in efforts that aren't necessarily looking at the entire picture or looking at the entire journey. Oftentimes the onus is left on the patient to kind of complete that next step. And what often happens is that we're purchasing different solutions that are kind of piecemeal together, and it makes for a very disjointed experience. But patient success is really about looking at the holistic picture. It's looking at a solution that can help have a consistent experience for the patient across all their different interactions, and is really has an eye for looking at what are the barriers for access, and making sure that patient reaches those, gets over those barriers and reaches those success outcomes. So just to walk through a practical example, at Luma Health, we work with a lot of patients, we work with a lot of partners based in the Texas area, and a significant portion of their patients have a preferred language of Spanish. And what we have found is that when we originally engaged them over English, there was a drop-off rate. And in the traditional definition of patient engagement, we were doing patient engagement. We sent them a message in English that said, hey, here's your appointment reminder, here's a waitlist management, or here is, you haven't been seen for your annual mammogram, please go ahead and schedule. But however, if you sent that, and so by definition, we were doing patient engagement. What we found that though, is that the engagement rates dropped off for patients who we were sending messages to in not their preferred language, which was Spanish. And so by merely switching that and meeting the patient where they are, we saw an greater engagement rate of 32%, which in the healthcare world, that really moves the needle. That really is what we're talking about here of pushing patients, not pushing patients, but driving patient success, having a solution that meets the patient to be able to make it successful for the patients to be able to reach those health outcomes. And really, it's also understanding where the patient is, forcing the patient to use a patient portal or asking the patient to use a patient portal can be challenging for many, particularly for patients who have already other challenges for access to care. Unfortunately, a fair number of the patient portals are geared towards a higher educational background. And not only that, but also one who is proficient in English. And as you can imagine in that previous example, this becomes difficult. And then again, the last part of this is really making it easy for the patients to understand what they need to do to be successful. Patients want to be successful. Patients want to be able to figure out, hey, what do I need to do next? But when they open up that patient portal, it's kind of like a restaurant menu without a waiter to help you understand what your choices should be. And so really having tools that help them understand, hey, this is what you need to do to be successful. And then just to kind of just to finish it off here, we've seen with our data set and with our solution tool that patients, again, want to be successful, and we offer a variety of tools where they can be successful. We have a smart cancellation management solution where patients can self opt in to be able to find and get connected to their providers and make it easy. And going back to that example of the patient who wanted to be able to cancel, reschedule, she wanted to be engaged. She wanted to be able to drive the success, but we provide the tools that the patients can actually be successful so they can remove we help them remove those burdens or those barriers for them to be able to be successful. So again, the kind of the summary of it is that we need to be able to focus on patient success and not just being able to drive engagement, but being able to remove those barriers and make it successful both for providers and patients to be able to reach those health goals.
Pardon me, it's not good form to cough on a mic. Tashfeen, thank you so much for sharing the provider's perspective of the great patient disconnect and how patient engagement really is only the start of the story, and patient success is where we need to be focusing. I'd like to invite Dan and Renee to join us now for a roundtable discussion. Dan shared a lot of information this morning about what patients have needed, what patients have wanted to, how they've expressed their desires and how they wish to work with healthcare. Tashfeen shared a lot about how providers view the challenges about patients wanting to be successful in their own care journeys. And I'm very excited to have Renee McKibben now join us as an actual operator from Maury Regional to really share her perspective in a roundtable discussion with us today. So I'm going to go ahead and kick off, and then Renee, the first question is going to go over to you because I think we all love to hear from an actual healthcare operator. So I think what Dan was really showing us earlier, and Tashfeen was showing us earlier, is consumerized healthcare. It's here to stay. Patients, they have more options, pricing, transparency, and regulation exists. They have a higher expectation of healthcare and their experience and how they engage. And then research really is starting to show. And I think Dan's voice of the patient data really kind of articulated this, which is, patients will go to one organization or another based on a better experience. So with the stakes this high, the actual business of healthcare at stake, the patient disconnect, not having what the patient needs and what the provider system's offering is probably a costly problem that can, have a really massive opportunity for those who get it right. So Renee, over to you for the first kind of question in that context, which is when you think about prioritizing those investments that kind of where you want to close the gap caused by the patient disconnect, how do you think about prioritizing them with, obviously finite time and finite resources?
Well, thank you so much for allowing me to participate today. And I think for us, the biggest challenge and the thing that has also provided us the most success is when we launch a tool or we do something that helps to bridge this gap, it has to meet the needs not only for the patients, but also the providers. You know, my job as an operations director is to try to look at everything that we bring to the table and really, you know, what floats to the top is what our patients need. And a lot of us in our community are also the patients that are, you know, experiencing the challenges when we don't have technology that kind of meets our needs, whether it's the online scheduling or the ability to communicate with our providers. So for us at Murray Regional, we partnered with someone that we felt like would be able to not only give our end user patients the experience that would be helpful for them, but then also for our practices and our physicians to have a tool that was intuitive and also helped the communication barrier and not necessarily require a bunch of hoops or a bunch of, you know, kind of difficult wayfinding and click on this link and then download this app and then fill out this form and then then you can finally do that. So Luma's been a great partner with us. I feel like a lot of times with ambulatory operations, you know, it's the same problems, a different name on the door. And so we try to, you know, look to those solutions that are available and make sense for both patients and providers, because you can't really have one without the other.
No, that's awesome, Renee, and thank you for sharing that. You know, how you evaluate, you know, looking at things that'll help close that patient disconnect. I think, Dan, I'd love to throw kind of the inverse side of that question over to you, which is, you know, Renee was sharing about how she makes choices, and you know, KLAS is in the business of actually helping health systems and provider groups make those choices. So I'm kind of curious to you, given based on the findings, the gaps that you shared with us, what advice are you giving to healthcare organizations right now in order to close that gap?
Yeah, that's a great question. And I love, Renee, your perspective on this of including both the voice of the provider and the patient in those technology decisions. And that's right in line with how we would give advice to an organization today. Historically, many of the patient engagement technologies, I would say 2, 3, 4 years ago, they were driven by a need for a provider organization. Well, we want to reduce our no-show rate. We want to make sure our appointments are filled. Well, we really believe that if you focus both on that need as well as the patient need, that the outcomes are going to follow. I'll give you a good personal example of mine. I recently switched from a small 3-doc practice to a provider that was part of our broader health system here in Utah. And I did it because I focus on our research over patient engagement here at KLAS, and my small practice didn't have a patient portal, and I really wanted to engage in the technology. So I did it. I switched over to this organization, and I needed to schedule an appointment. So I was really excited to go into my portal and schedule for the first time. And I love that term, digital dead end. I just heard that a couple of weeks ago for the first time. I hit one of those digital dead ends. I found a time that would work for me. I clicked the button to schedule, and what did it do? It didn't automatically schedule that appointment. It triggered the organization to call me back. Well, I was doing this late at night. So of course, when they tried to call me back the next day, I have a busy day full of meetings at work, couldn't answer the phone. The appointment, I can't remember anymore if it was available or not by the time I got back to them. But consider from the patient point of view, if I'm able to schedule that appointment at night when it's convenient for me at a time that I know is convenient for my schedule, am I going to come and fill out an appointment? Absolutely. Will there be a no-show that causes lost revenue? Likely not. I'm doing it as a patient for what's convenient, and I'm driving a provider organization's outcome. So I think finding that balance where you are meeting a patient need and then it will drive the provider organization's outcomes. We're pretty confident about that.
Awesome. And we're going to be running close to the end of time here. So I'm going to actually make a little turn right here. And I would love to get from each one of you, and maybe Renee, we'll start with you again. We'll go Dan, then to Shveen to wrap us home for this Monday morning. I'd love to hear from you in a sentence or two. What does it mean from where you sit in your chair in your kind of day jobs and kind of where you feel passionate about? What does it mean to you for a patient to be successful? You know, Dan, you shared from your personal experience, Renee, clearly a world-class operator. I'd love to hear from, you know, Renee, why don't we start with you? And what does it mean for you to, you know, how to make patients truly successful?
So to me, it's all about communication. and meeting people where it is that they are. We serve a incredibly diverse Southern County area with all sorts of infrastructure, both positive and negative. And so for us, what's successful is meeting the patient where they are with their capabilities of communication, and then also matching that with the technology that's available so that it's not a perception that someone's needs are being met through our communication efforts and vice versa.
Awesome, Renee. I think that, meeting the patient where they are is such a common theme from this morning. Dan, maybe it's a little bit from I know you shared it yourself as a patient, but I'm curious to see from like KLAS's perspective and what you saw in the data. What does it take to make a patient successful, and what does that mean to you?
Yeah, I think to make a patient successful is to allow them to be empowered in their care and to engage digitally the way they do with so many other industries. I think the pandemic really brought consumers to the forefront, and we expect a similar experience across all of the industries that we work with: banking, hospitality, travel. We've got great experiences in so many other industries, and I'm not foolish enough to say the problem is easy to solve in healthcare. I know scheduling, for example, is a whole nightmare to figure out as an organization. But when you're able to create that experience for a patient, I truly believe you're getting a patient for life. You're creating an experience that's going to keep them engaged with your organization. And hopefully it leads to better health outcomes for them and better financial outcomes for your organization.
I completely agree that we all want it to be as easy as buying, is like getting an airplane ticket, but in buying a flight, there's business class and economy class. There's 2 visit types. And Renee, you probably have about 1,000 visit types at MRH, and I think we can all understand and respect the complexity, and this is why we do the work that we do. Tashfeen, over to you. Patient success, what does it mean to you?
Yeah, I think Renee and Dan hit it on the nail. I think the only thing I would add from a provider's perspective is that when we see our patients succeed, it actually drives a lot of providers' satisfaction. And I think I just outlined that the Institute of Medicine had talked about how we can solve a huge problem in healthcare by finding solutions that can drive patient success by increasing patient happiness, by driving patient outcomes, and dropping costs. And I think that the secret solution here is patient success. If we can have solutions that focus on patient success and not just by driving engagement, but actually ensuring that patients get to the end goal, I think we can solve a huge problem in our healthcare system.
Yeah, I think that's incredible. So I want to say thank you for everyone. We had a very quick and robust discussion this morning. I would love to, we can put back on the slides, everyone's do a quick thank you here. So really, thank you, Dan, for kind of sharing with us the overall kind of perspective of really what the patient is saying and how we've actually had this large disconnect. And I think you did a wonderful job of articulating what vendors have had a disconnect, honestly, in what the patients need. Renee, thank you so much for sharing really like what it means to be actually, an operator kind of trying to build wonderful ambulatory systems in a very complex delivery environment, and how putting tools in patients and meeting patients where they need really needs a new approach where it works for both the provider and the patient in order to let the system be successful. And Jashreen, as usual, thank you for sharing the provider's perspective of, how do you help providers? How do you help patients? And ultimately providers want to help patients be successful. If we can do that in a way that helps all boats rise, that ultimately is what patient success is. So I'd like to thank everybody for their time this morning. And thank you to all my panelists who joined me. Everyone have a great Monday, enjoy a wonderful week. And if wherever you are, if it's hot, stay cool and enjoy the rest of July. Thanks so much.